Thank you very much. Thank you for the challenge and for the invitation. Let me just begin by saying what an impressive turnout this. This is a Monday night in July, folks. And I was struck by, just a flash of scripture came into my head, which I have been informed by reliable sources from the 133rd Psalm, how beautiful it is when people dwell together in unity. And that's what I think as I look out and see each of your faces, church congregations, synagogues, mosques, people from the different communities in Northern Virginia coming together to advance the cause of each other, to advance the cause of community. And it makes me feel great to be with you tonight. I will say that I've met with the Voice leadership once in Richmond and then once in Fairfax already to become aware of your priorities. At the last meeting I was at, you invited me to come and be with you tonight so that I wouldn't just be sitting in a small room with a few folks, but that I would have a chance to address all of you, the representatives from the now 45 congregations I've been informed are part of Voice. So let me talk about dental care. This is a huge and important issue, and it's one that we've worked together on a good bit over the last few years as I approach my last 6 months as governor, but where there is still a very, very significant gap. And that is dental care for low-income adults. In 2006, if we had been having this meeting, I have a feeling that Voice's request would have not been limited to low-income adults, but it would also have been about low-income children. But since 2006, working together with David Bullitt and other members of the legislature, we've been able to expand the number of children who are served by dental care in Virginia by 100,000. At a time when we have been reducing, unfortunately, because of the recession, the state budget by $6 billion, we've nevertheless expanded dental care to kids so that 100,000 more are served than was the case just 3 years ago. We have also put significant dollars into the healthcare safety net, the free clinics and community health centers. Just recently, again, the legislature worked in the 2008 session to put an additional $3 million into the free clinics and community health centers, of which portions were earmarked for dental care. But we still have a problem with adults. Many of you went to the Mission of Mercy Dental Clinic that was held at the Springfield campus at Northern Virginia Community College about 2 months ago, where people line up to get free dental care for the weekend by the hundreds and thousands, and it's a staggering thing. This Friday, probably the most visible evidence of the lack of a comprehensive health care program in this nation is going to be held at a fairgrounds at the other end of Virginia, Wise County, Virginia, in Appalachia, where people drive for days and park in a county fairground parking lot for days so that they can get free dental care and also other kinds of medical care. I'll be there as a volunteer, and I've walked through that parking lot, and I've seen vehicles from Oklahoma, and I've seen vehicles from Florida, from Northern Virginia, certainly in so many other states where people aren't receiving the care that they need. So I want to begin and just say that I hear you. This is a very, very difficult issue. Some think that dental care is a nicety, not a necessity, but the impact on your life, on your employability, on its leading to other medical challenges if you don't get proper dental care is severe. The policy we now have in Virginia that will pay Medicaid dollars for extractions only when it gets so bad that you have to get that to reduce pain, but not pay anything for Medicaid for care so that you never need to get to that point is not a fair or just policy. So what I will say to you, and we have had this conversation before, having made advances on dental care for kids, again at a time when we're making cuts, I will be honest, until Voice came into my office back in January or February, going the next step and finding solutions for dental care for adults was not going to be part of my to-do list for my 4 years as governor. Getting the kids was on my list. The adult issue was not on my list, and I'll be candid. The issue is now on my list purely because it was in addition to meeting with me, I've had voice representatives meet with my Secretary of Health and Human Resources, Marilyn Tavenner, who began her career as a nurse and has worked her way up to be a public servant and a healthcare administrator. And Marilyn is working, and I do not have a solution that I can put on the table right now, because as the economic challenge continues, I've just had to send a letter to state agencies asking them to find additional budget cuts in this fiscal year. But one of the few things that I have directed a staff member, even though it's going to cost more, let's look, let's try to be creative, let's try to find something, is this issue of dental care for adults. And so my health secretary is working on it. We will be making decisions on the budget largely in probably late September, October, and early November. I commit to sitting down with the voice leadership in that time frame, as we are more cognizant of the revenue situation and cuts that we have to make to see if there is room to do this. I would love to come and tell you tonight I've got an announcement. I don't normally announce the budget until December, so we're still premature in the budget process. And so I can't tell you whether this will be in it, or if so, how much will be in. But I can tell you that this issue, again, candidly, I guess, was not on my radar screen. You've put it on my radar screen. I've got a Secretary of Health and Human Resources that believes in it very deeply. And if I could say one more thing about this, this is an example, and we could give a lot of examples, and the testimonies were an example. This is an example of why so many Americans are working so hard right now, to see if we can find a way to provide the same kind of comprehensive health care that every industrialized nation in the world provides, so that our citizens will have health care. And as you see every day, there's mention of this. It's challenging, it's tough, it's being debated as it ought to be. It's a big and tough issue being debated at the federal level, but we all have a stake in that, a deep, deep stake in it. Whether we have insurance or not, whether we have medical care or not, we have a deep stake in it. And just one statistic, and then I know there's a second question that you want to ask me. At least a second question. Did you know in 1993, just 16 years ago, 61% of small businesses in this country offered health insurance to their employees? Today, that number is 38%. It's falling like a stone, even as costs are going up. The percentage of our people who are covered are falling. And so we are living in a moment where we have been able to get health care bills passed in 2 House committees and a Senate committee. They've never even passed any committees. We have been able to do that. And they won't address all the problems and challenges of the healthcare system, but they represent the best hope we have for doing that just thing that Voice is about, and making sure that we join the other nations of the world that just consider it fundamental for our citizens to have health care, and health care in an affordable way that won't break the bank for family, won't break the bank for businesses. And so I will work with you on this dental issue. In the short term, if I can rattle the cash drawer and find anything, and again, having give agencies directives that they need to give me budget cutting reports, the short term is challenging. But in the budget that I'm preparing on the way out, if there is any way that I can see, in tandem with any partner that wants to come to the table to work with me, to try to figure out ways, having tackled the problem of low-income kids, to now tackle the problem of low-income adults, I'll do it, and I wouldn't have done it, and it wouldn't be on my radar screen had it not been because of Voice.